In 2025, Singapore is leading the way in healthcare innovation. With its well-established reputation for being a global leader in technology and healthcare, the country is now at the forefront of a new healthcare revolution, powered by artificial intelligence, AI, health data technologies, HDTs, and integrated therapy models, ITM. These innovations are not just transforming how healthcare is delivered, but also how it is experienced by citizens and professionals alike. Let's explore how Singapore is utilizing these cutting-edge technologies and strategies to not only solve its own healthcare challenges, but also set a new global standard in healthcare excellence. Chapter 1. AI, the brain behind Singapore's healthcare transformation. Artificial intelligence, AI, has rapidly become a transformative force in healthcare, and Singapore stands at the forefront of this evolution. In 2025, AI is not just a tool, but the brain driving the nation's healthcare system, enhancing everything from patient care to surgical precision. Let's explore how AI is revolutionizing healthcare in Singapore, making the country a global leader in this space. AI in diagnostics, precision beyond human capabilities. One of the most profound impacts of AI in Singapore's healthcare sector is in diagnostics. AI algorithms are being used to analyze medical images such as CT scans, MRIs, and X-rays with exceptional speed and accuracy. Unlike traditional methods where a radiologist or doctor may take minutes or even hours to review an image, AI systems can analyze these images in a fraction of the time, identifying patterns and abnormalities that might be invisible to the human eye. These AI models are trained on millions of images, allowing them to learn from vast datasets and improve their diagnostic accuracy over time. In 2025, these AI systems can detect a wide range of conditions such as cancer, cardiovascular diseases, and early signs of diabetes before the patient shows any symptoms. For instance, AI can identify the smallest nodules in lung scans that could indicate early-stage cancer, providing doctors with the opportunity for early intervention. Early detection and diagnosis can significantly improve patient outcomes, enabling doctors to adopt preventive care strategies instead of reactive treatments, which can often be less effective. Personalized medicine with AI, tailoring treatment plans. AI is also driving the shift toward personalized medicine, which is one of the most promising aspects of modern healthcare. Traditionally, treatment plans have followed a one-size-fits-all approach, where doctors rely on generalized guidelines based on large populations. However, in 2025, AI has enabled Singapore to move toward a much more individualized approach to healthcare. AI can analyze a vast array of data points, including a patient's genetic information, lifestyle factors, and comprehensive medical history. This allows AI to suggest treatment plans specifically tailored to each patient's unique health profile. For example, AI-powered systems can examine genetic markers to predict how a patient might respond to a particular drug or therapy, helping doctors avoid trial-and-error prescribing. This precision not only increases the likelihood of successful treatments, but also reduces the risks of adverse reactions, making healthcare safer and more effective. AI-powered robotics in surgery, enhancing surgical precision. In the operating room, AI-powered robotics are revolutionizing surgery. These robots, equipped with AI algorithms, assist surgeons in performing delicate procedures with extreme precision. The robots can analyze a patient's anatomy in real time, adjusting their movements with millimeter accuracy, which reduces the margin for human error. This capability is especially important in minimally invasive surgeries, where smaller incisions are made, resulting in faster recovery times, less scarring, and fewer complications. For example, robotic systems equipped with AI can assist in neurosurgery, where precision is crucial. AI helps the robotic system navigate complex brain structures, making it possible for surgeons to perform operations that would be impossible with traditional methods. Furthermore, AI systems collect data during each surgery, feeding it back into the machine's algorithms, allowing for continuous learning. As more surgeries are performed, the AI becomes more adept at predicting potential issues and refining its precision. In conclusion, AI is the cornerstone of Singapore's healthcare transformation, making medical procedures more efficient, precise, and personalized. The integration of AI into diagnostics, treatment plans, and surgery is reshaping healthcare in Singapore, and setting the stage for a new era of patient care worldwide. Chapter 2. Health Data Technologies, HDTs, Data-Driven Decisions for Better Healthcare. In 2025, health data technologies, HDTs, have emerged as a critical force in Singapore's healthcare transformation. With an increasing reliance on data-driven insights, HDTs empower healthcare professionals and policymakers to make more informed, precise decisions. The integration of these technologies not only improves patient care, but also streamlines processes across the healthcare system, enhancing overall efficiency and effectiveness. HDTs for patient monitoring, real-time insights for early intervention. Wearable health devices and connected medical equipment are revolutionizing how patients are monitored in Singapore. These devices, which range from smartwatches to specialized medical sensors, allow for continuous tracking of various vital signs such as heart rate, blood sugar levels, oxygen saturation, and even sleep patterns. The real-time data collected by these devices is automatically synced with patients' electronic medical records, allowing healthcare providers to gain up-to-the-minute insights into their health status. This continuous stream of data enables doctors to track patients' conditions outside the clinical setting, reducing the need for frequent in-person visits. For example, a diabetic patient's blood sugar levels can be monitored remotely, and if an abnormal fluctuation is detected, the healthcare provider is immediately alerted and can adjust the treatment plan accordingly. This proactive approach to healthcare ensures that issues are caught early, preventing complications and minimizing the need for emergency interventions. Additionally, patients with chronic conditions, such as hypertension or heart disease, can be continuously monitored. This kind of ongoing surveillance helps doctors detect potential health risks before they escalate, leading to timely adjustments in medication or lifestyle recommendations. The shift from reactive care to proactive, real-time monitoring represents a major leap forward in managing chronic diseases and enhancing overall patient outcomes. Predictive analytics, anticipating healthcare needs. Singapore's healthcare system is harnessing the power of predictive analytics, powered by HDTs, to anticipate future healthcare needs. By analyzing massive datasets, AI and machine learning algorithms can forecast which individuals are at risk of developing chronic diseases or experiencing significant health issues in the future. Predictive analytics considers a wide range of factors, including medical history, lifestyle choices, environmental influences, and genetic predispositions. This allows AI to identify high-risk patients and predict the likelihood of diseases such as cardiovascular conditions, diabetes, or even mental health disorders. For instance, a combination of lifestyle data, such as diet and exercise, and genetic information might indicate a patient's increased risk for developing type 2 diabetes years before symptoms would typically manifest. By using predictive analytics, healthcare providers in Singapore can intervene early, offering preventive care strategies such as lifestyle counseling, medication, and regular screenings. This anticipatory model not only improves the quality of life for patients, but also reduces the long-term financial burden on the healthcare system by preventing expensive treatments for advanced diseases. Data integration for holistic healthcare. A comprehensive picture. The true power of HDTs in Singapore lies in their ability to integrate vast amounts of diverse data. Gone are the days of fragmented patient information stored across different systems. Now, HDTs bring together data from multiple sources, including medical records, lab results, wearable devices, and even data from fitness trackers like steps taken, calories burned, and hours slept. This integration allows healthcare providers to get a holistic view of a patient's health. For example, a doctor can combine data from a patient's genetic profile, daily exercise routines, and previous medical treatments to create a comprehensive, personalized care plan. This makes it easier for healthcare professionals to diagnose conditions more accurately and to craft treatment plans that are tailored to the individual's unique health needs. Moreover, HDTs provide patients with direct access to their health data through user-friendly apps and portals. This gives individuals more control over their health by enabling them to track their own progress, monitor health changes, and make informed decisions about their well-being. Such transparency also fosters better communication between doctors and patients, leading to more collaborative and effective care. In conclusion, HDTs are driving the next generation of healthcare in Singapore. Through patient monitoring, predictive analytics, and data integration, these technologies are enabling early interventions, more accurate diagnoses, and a more personalized approach to care. As Singapore continues to harness the potential of HDTs, the country is shaping a future where healthcare is more connected, efficient, and accessible than ever before. Chapter 3. Integrated Therapy Models, ITM, Redefining Patient-Centered Care. Singapore's healthcare system has long been recognized for its commitment to patient-centered care, focusing on individualized treatment that respects each patient's unique needs. In 2025, integrated therapy models, ITM, are taking this approach a step further, offering a more comprehensive and holistic method of treating patients. By combining a variety of treatment modalities, including conventional medicine, traditional therapies, and lifestyle interventions, ITM creates a unified and tailored care plan for every patient. Multidisciplinary care teams, collaborative healing. The foundation of ITM lies in the creation of multidisciplinary care teams. These teams consist of diverse healthcare professionals, each contributing their expertise to address all aspects of a patient's health. Instead of relying solely on a single physician to treat the patient's condition, ITM brings together specialists from different fields, fostering collaboration and comprehensive care. For instance, consider a patient suffering from chronic pain. Rather than only receiving pain medication from a doctor, the patient's care team might include a nutritionist who can recommend diet changes to reduce inflammation, a physical therapist who can guide the patient in strengthening muscles to alleviate pain, a psychologist who can provide emotional support and help the patient manage stress, and even a social worker who can address social factors affecting the patient's well-being, such as family dynamics or financial stress. This holistic approach ensures that no aspect of the patient's health is overlooked. By addressing not only the physical symptoms, but also the emotional, mental, and social factors, ITM leads to more effective treatment, faster recovery times, and improved overall patient satisfaction. This team-based care is particularly beneficial for managing chronic conditions, where multiple factors contribute to the patient's health and well-being. Combining modern and traditional medicine, a balanced approach. One of the most exciting aspects of ITM is its integration of traditional and modern medicine. Singapore has long been known for its culturally diverse healthcare offerings, blending Eastern and Western medical practices to offer patients the best of both worlds. In 2025, this integration has become a hallmark of ITM, allowing patients to benefit from both conventional Western treatments and traditional therapies such as traditional Chinese medicine, TCM. For example, acupuncture may be used alongside Western pain management methods to offer a more well-rounded approach to treating chronic pain. Studies have shown that acupuncture can enhance the effects of painkillers, reduce inflammation, and improve circulation, providing significant relief to patients who may not respond well to conventional treatments alone. Similarly, herbal remedies from TCM, such as ginseng or turmeric, are being incorporated into cancer treatment plans to help boost immunity and support the body during chemotherapy. The use of traditional therapies alongside modern treatments allows for a more comprehensive, personalized treatment plan that addresses both the symptoms of a condition and the underlying imbalances in the body. By taking a more flexible, open-minded approach to healthcare, ITM offers patients a broader range of options to help them feel better faster and heal more completely. AI-enhanced ITM, personalized care with precision. AI plays a critical role in enhancing the effectiveness of ITM by offering personalized, data-driven insights that guide treatment decisions. By analyzing vast amounts of patient data such as medical history, lifestyle factors, and genetic information, AI algorithms can help healthcare providers identify the most effective treatment modalities for each individual. For instance, AI can help physicians develop a comprehensive care plan by suggesting the best combination of therapies, whether they involve medication, physical therapy, nutrition, or traditional medicine. AI-powered tools can also track patient progress, analyze the effectiveness of treatments in real time, and adjust care plans as needed. This dynamic approach ensures that every patient receives the most appropriate effective treatment based on their evolving health status. Moreover, AI-driven tools are also used to predict long-term outcomes, allowing healthcare providers to make proactive adjustments to a patient's treatment plan. For example, if a patient's condition shows signs of worsening, AI can alert the care team to intervene early and prevent further complications. This real-time feedback and adaptability improve treatment outcomes and ensure that patients receive the best possible care throughout their recovery. Conclusion: a new era in patient-centered care. By integrating multiple treatment approaches and harnessing the power of AI, integrated therapy models, ITM, are revolutionizing patient care in Singapore. The combination of multidisciplinary care teams, modern and traditional medicine, and AI-enhanced treatment plans offers a comprehensive and personalized approach to healthcare that addresses every aspect of a patient's physical, mental, and emotional health. This holistic model not only improves outcomes, but also ensures that patients are treated with the utmost care and respect, allowing them to heal in a more balanced and comprehensive way. As ITM continues to evolve, Singapore is setting a new global standard for patient-centered care that is both innovative and deeply rooted in empathy and compassion. Chapter 4: Real-life success stories. Singapore's AI and healthcare revolution in action. Singapore is not just talking about healthcare innovation. The country is actively implementing cutting-edge technologies like AI, health data technologies, HDTs, and integrated therapy models, ITM, to create tangible, life-saving changes. These technologies have already been put into action, leading to remarkable success stories that showcase their power in transforming patient care and outcomes. Let's dive into a few real-world examples where AI, HDTs, and ITM have made a significant impact. AI in early cancer detection. Life-saving precision AI's potential in early cancer detection is already saving lives in Singapore. One striking case involved the use of AI algorithms to identify early-stage lung cancer in a patient who showed no symptoms. Traditional methods of diagnosis might not have caught the subtle signs, but the AI system flagged a small anomaly in the medical images, prompting doctors to investigate further. The early detection of the cancer enabled timely intervention, resulting in successful treatment that saved the patient's life. This success highlights AI's ability to catch diseases like cancer at the earliest, most treatable stages, even before symptoms appear. AI doesn't just help doctors make quicker decisions, it enhances their ability to detect patterns that human eyes might miss. In this case, the patient was given a fighting chance because of AI's ability to identify even the slightest change in medical data. This is not an isolated instance, but part of a broader trend where AI-driven diagnostics are becoming more accurate and effective, fundamentally transforming how early-stage cancers are detected and treated across Singapore. HDTs in chronic disease management, monitoring, and proactive care. Chronic diseases, like diabetes and hypertension, are a significant burden on healthcare systems worldwide. In Singapore, however, health data technologies, HDTs, are helping to reduce these burdens by enabling proactive disease management. Patients with conditions like diabetes are provided with wearable devices that track their vital signs, such as blood glucose levels, blood pressure, and heart rate continuously. These devices sync in real time with healthcare providers, ensuring that medical professionals have immediate access to crucial health data. This constant stream of data allows doctors to monitor their patients' conditions from a distance, making it possible to intervene before a patient's health deteriorates. For example, if a diabetic patient's blood sugar levels fluctuate outside the desired range, the healthcare provider is alerted and can adjust the treatment plan accordingly. This ability to respond quickly and proactively has drastically improved patient outcomes, reduced emergency room visits, and minimized hospital admissions, all while ensuring that patients receive personalized care based on their real-time health data. The use of HDTs in chronic disease management not only improves the quality of life for patients, but also reduces long-term healthcare costs. By addressing potential issues early, healthcare providers can avoid expensive hospitalizations and reduce the overall burden of chronic disease management, leading to a more sustainable healthcare system. ITM in mental health care. A holistic approach to emotional well-being. Mental health care is another area where integrated therapy models, ITM, are making significant strides. In Singapore, ITM is being used to treat patients with depression, anxiety, and other mental health conditions by combining multiple approaches. Instead of treating just the symptoms, healthcare providers create personalized treatment plans that address the emotional, psychological, and social aspects of a patient's life. A typical mental health care team in Singapore may include not only psychologists and psychiatrists, but also nutritionists, physical therapists, and even social workers. This multidisciplinary approach ensures that all factors contributing to the patient's mental health are considered. For example, nutritionists may help manage the patient's diet to improve mood stability, while physical therapists may assist in improving physical health, which is closely linked to mental well-being. This holistic approach has already shown significant benefits. Patients report feeling more supported, with a stronger sense of understanding and care. Instead of focusing solely on medication or therapy, ITM looks at the patient as a whole person, which fosters deeper healing and more sustainable mental health recovery. By integrating traditional mental health practices with nutrition, physical activity, and social support, Singapore's mental health system offers a comprehensive solution that leads to more positive outcomes and better overall quality of life for patients. Conclusion: a model for the future. These real-life success stories are just the beginning. Singapore's healthcare system is a shining example of how AI, HDTs, and ITM can work together to create a more efficient, personalized, and holistic healthcare experience. From detecting cancer at its earliest stages to proactively managing chronic conditions and providing comprehensive mental health care, these technologies are saving lives and improving the well-being of the nation. As these innovations continue to evolve, Singapore is setting the stage for a future where healthcare is not just reactive, but proactive. Not just technical, but also deeply human. By embracing the power of AI, health data technologies, and integrated therapy models, Singapore is not only transforming its own healthcare system, but also providing a blueprint for other nations to follow. These success stories demonstrate the incredible potential of healthcare technology to improve patient outcomes, reduce costs, and make care more accessible and efficient for everyone. Chapter 5. The Future. What's next for Singapore's healthcare system? As we look toward the future, Singapore's healthcare system stands on the cusp of even greater innovation. With AI, health data technologies, HDTs, and integrated therapy models, ITM, already playing pivotal roles in transforming care, the next decade promises to bring even more profound changes. These advancements will not only improve the efficiency and effectiveness of healthcare delivery, but also enhance patient satisfaction and overall health outcomes. Here's a glimpse into what the future holds for Singapore's healthcare system. Expansion of AI-powered clinics, making healthcare more accessible. One of the most exciting developments on the horizon for Singapore is the expansion of AI-powered clinics. These clinics will leverage the power of AI and machine learning to offer routine checkups, diagnostics, and even some treatments, all through AI-driven systems. By reducing the need for in-person visits and minimizing wait times, these clinics will provide accessible, affordable healthcare to residents across the island. AI-powered clinics will be able to handle a wide range of tasks. For example, AI algorithms will analyze patient data, including medical histories and lab results, to offer diagnoses or recommend treatments. Virtual consultations, where patients interact with AI-driven systems or healthcare professionals remotely, will become the norm, enabling patients to receive care from the comfort of their homes. These clinics will also be essential in addressing the increasing demand for healthcare services as Singapore's population grows and ages. By making healthcare more efficient and less time-consuming, AI-powered clinics will help meet the needs of an aging population while maintaining a high standard of care. As a result, patients will enjoy more timely interventions, personalized care, and reduced healthcare costs. Increased focus on preventive care. Shifting to proactive healthcare. Another key area where Singapore's healthcare system is poised to evolve is its increased focus on preventive care. Traditionally, healthcare has been reactive, with treatment provided after an illness or condition has developed. However, with the growing capabilities of AI and predictive analytics, Singapore will continue to shift towards a more proactive model that emphasizes prevention over treatment. AI systems, powered by large datasets and predictive algorithms, will allow healthcare providers to anticipate health risks and intervene early. These systems will analyze patient data such as medical history, lifestyle choices, genetic predispositions, and environmental factors to predict which individuals are at higher risk of developing chronic diseases like diabetes, heart disease, and even cancer. By identifying at-risk individuals early, healthcare providers can offer targeted interventions such as lifestyle modifications, preventive medications, and regular screenings. This proactive approach will not only help patients stay healthier for longer, but also reduce the long-term healthcare costs associated with treating advanced stage diseases. Preventive care will also be deeply integrated into Singapore's public health policies. The government will continue to invest in health promotion initiatives, such as community health programs, fitness campaigns, and nutrition education. With the help of AI, the country will be better equipped to prevent disease before it occurs, improving the overall health of the population and reducing the burden on the healthcare system. Global leadership in healthcare innovation, sharing knowledge and expertise. As Singapore's healthcare system continues to evolve and lead in the integration of AI, HDTs, and ITM, the country is positioned to become a global leader in healthcare innovation. The advancements Singapore has made in AI-driven diagnostics, predictive analytics, and integrated care models serve as a model for other nations striving to improve their own healthcare systems. Singapore will continue to share its healthcare innovations with other countries through global collaborations and partnerships. By working with other governments, international health organizations, and private companies, Singapore can help improve healthcare systems around the world, especially in countries with fewer resources. These collaborations could focus on areas such as health data sharing, AI adoption, and the integration of traditional and modern medicine. By sharing best practices, technological expertise, and research, Singapore can help bridge health disparities across the globe, ensuring that high-quality healthcare becomes more accessible to all. Moreover, Singapore's leadership in healthcare innovation will drive research and development efforts that can benefit not only its own residents, but also people around the world. As the country's healthcare system continues to break new ground, Singapore will be at the forefront of shaping the future of healthcare, from the use of AI to personalized medicine and beyond. Conclusion: revolutionizing healthcare through technology and care. By integrating artificial intelligence, AI, health data technologies, HDTs, and integrated therapy models, ITM, Singapore is transforming healthcare into a model of innovation and efficiency that was once thought impossible. In 2025, these advancements have positioned the country as a global leader, setting the benchmark for healthcare systems worldwide. The convergence of AI's data processing power, HDT's real-time health tracking, and ITM's holistic, patient-centered approach is reshaping the way care is delivered, ensuring that patients receive the most personalized, effective treatment possible. For Singapore's residents, this revolution translates into more accurate diagnostics, individualized treatment plans, and greater accessibility to healthcare services, all at lower costs. The use of AI in diagnostics, predictive analytics, and decision-making ensures that healthcare is not just reactive, but proactively addresses potential health risks before they escalate. Globally, Singapore's healthcare model offers a vision of the future, where technology and compassionate care are seamlessly integrated to improve lives. As these technologies continue to evolve, Singapore will inspire healthcare systems around the world to adopt similar innovations, fostering a future where health is better managed, more equitable, and accessible for all.